Chronic glaucoma, a two-stage disease. The purpose of this study was to determine the cause of the orderly peripheral-to-central loss of nerve fibers in chronic glaucoma. We compared the morphology and histology of the glaucomatous disc with non-glaucomatous optic atrophies. There were significant differences between the two groups. In glaucomatous discs, there was sloping and kinking of blood vessels and disc excavation, whereas in non-glaucomatous optic atrophies, blood vessels at the disc margin were straight and no excavation present. There are two established facts in glaucoma. First, nerve fibers in the optic disc are always being destroyed one by one from peripheral to central in an orderly sequence. Second, the elevated intraocular pressure is a definitive cause of glaucoma. Prevalent theories do not explain the orderly peripheral to central loss of nerve fibers in chronic glaucoma. This study hypothesizes that glaucoma is a two-stage disease. The first stage, degeneration of the border tissue of ELSCHNIG. The second stage, sinking of the lamina cribrosa and the orderly exotomy of nerve fibers. In normal tension glaucoma, the normal range IOP is acting as elevated IOP in circulatory compromised subjects. Scleral edge, not optic disc or retina, is the primary site of injury in chronic glaucoma. Due to exotomy, the arcuate nerve fibers, being fewer in number compared to the macular nerve fibers, are depleted earlier, resulting in the sharply defined arcuate field effects. Evidence of exotomy of nerve fibers and severance of vasculature. Notching at the inferior and superior poles is the earliest excavation due to exotomy and depletion of arcuate nerve fibers. Histology of the end-stage glaucomatous disc reveals a disc area totally empty of nerve fibers, which can only be explained by their exotomy. Chronic glaucoma may not be an optic neuropathy, but an optic disc exotomy.